Okay, welcome everybody. We're so glad that you could join us today. My name is Rebecca Dorman and I'm the Director of Invest in Children and the Cuyahoga County Office of Early Childhood. We are so pleased to welcome you to this second webinar that we have hosted on COVID-19 and children. To be honest, we sort of hope it's our last webinar on this topic because we'll be able to go back to talking about things that we would rather be talking about. But for right now, we're delighted that we're able to bring you this information today. We did our first webinar back in August, which isn't that long ago, but in COVID time, it's a world ago. The onset of Omicron and the skyrocketing cases locally and across the country have shown us how quickly things can change, challenging our healthcare providers who must respond in real time to the new challenges, and also working together the most accurate and up-to-date information to share with the public, all of us. We really thank our healthcare heroes for all that they are doing to get us through this pandemic. Two of them are here with us today, and we're really happy to help them reach all of you with the latest information. At Invest in Children, we're committed to providing forums such as this to get up to the minute information out to the community. In this case, it's statewide, which we're thrilled about. In particular, we want to highlight today what we as parents, grandparents, childcare providers, and stakeholders should know about the Omicron variant in particular, and the pandemic in general right now as it relates to young children and their families. Again, we've seen that many of you are new to perhaps to Invest in Children. And so welcome. I want to just take a minute to introduce you to who we are, and then we will get on to our featured guests. We are thrilled to have Drs. Hoyen and Edwards of University Hospitals with us again. They're two national experts on this topic who we're lucky to have in Cleveland. We're also so grateful to Starting Point, our regional childcare resource and referral, who's partnered with us on this webinar. So before we get into the meat of the discussion, let me just quickly go to our first or next slide and talk about our mission. So as you see, Invest in Children is a public-private partnership. We're over 20 years old now. And we mobilize resources and research to ensure the well-being of all young children in Cuyahoga County. And we are particularly happy today to be fulfilling one aspect of our mission, which is building awareness. Next slide, please. We provide a range of services through our partners in the community, through our agencies, and that continuum runs prenatal until kindergarten, everything from home visiting to early childhood mental health services to our universal pre-kindergarten program. And to learn more about all of that, please visit our webpage, but I won't take time to go into that today. I do want to tell you, however, a little more about our universal pre-K program. Next slide, please. So UPK is the gold standard of preschool in Cuyahoga County. We want folks to know about it. Everyone knows that right now the childcare system has been stressed to the maximum, along with the families who utilize our system. We do have a very special program in Cuyahoga County called UPK, which supports our families with scholarships and also supports the programs with extra funding, training, and technical assistance. We urge you, if you are in the market for a child care program, a preschool program, now or in the future, find out more about us by going to Cuyahoga Kids or our website, and you see the QR code there too. So that's sort of the end of my commercial for Invest in Children. Now I want to go on to our presenters. So next slide, please. Dr. Claudia Hoyen, who will be speaking to us first, is the Director of Pediatric Infection Control, University Hospitals Rainbow Baby and Children Hospital. She's a co-director of the UH system as well as director of pediatric innovation. Dr. Amy Edwards, associate medical director of pediatric infection control at Rainbow Babies and Children's. She's also a physician in the new UH COVID recovery clinic. So both of them are really on the front lines of what is happening with COVID and children. So I'm going to turn it over to Dr. Hoyen first. And please put your questions in the chat. We're going to try to get to as many as possible after we have heard from both of our presenters. So Dr. Hoyen, I will turn it over to you.
And good morning. Thank you so much for having us. It's a lovely sunny day here in Cleveland, which is so exciting. And we're here in our third winter of COVID. And as Rebecca said, sorry, we have to be with you, but happy that you're having us. And Rebecca, I have tried to share my slides, but I am getting that the host has disabled. Is there any way that John can allow me to share my slides?
I think that's a job for Ricky. So Ricky, can you make that happen?
Yep, go ahead.
Try now, Claudia.
All right. Okay. I am on my way. Can you see them? Fantastic.
Yeah.
All right, great. So as we said, this is a talk on COVID. And as Rebecca also said, we know that things literally change day by day when it comes to COVID. What we'll be talking about really is for informational and educational purposes only. And really, this should not be used as a replacement for any personal or legal advice that you might, medical or legal advice that you might get from your organizations that are your regulatory agencies. And we need you to comply with all the legal requirements that you have under your groups. And although this is reviewed by healthcare professionals, again, since things change so quickly, you just need to keep up to date every day, but happy to share this information with you today. Again, here we are in Ohio. We can see that we have lots of cases. And we'll continue to be on the downswing. We can see that we've peaked here in the United States, and we are moving down not only in the United States but also in Ohio. Northeast Ohio, I can tell you, is at the very front of this edge. We had a communication this morning. We had a webinar with all of the Ohio children's hospitals and other parts of the state in Ohio, Columbus, Cincinnati, even to the west of us in Toledo, are weeks behind us. And so they are still seeing many children hospitalized. And so we are hopefully the bearer of good news for the rest of the state, in that we are starting to see not only the cases outside the hospital and in the outpatient clinics, but also those cases within the hospital starting to come down.
Claudia, can you start it as a slideshow? I think that will make the slides bigger. Yeah,
sure,
thank you.
Absolutely. All right, I think we've got it. There we go. Thank you. All right, as you can see, we have still within the country and worldwide, you know, we're still getting to a peak with Omicron. But again, here in Northeast Ohio, we have already peaked. I believe Terry Allen did let us know that last week. And so excited to for once be ahead of the curve. Now I can't get my slides to forward. I am so sorry. Okay.
Okay.
Oh,
Good.
yep, got it.
Got it.
Yep. And so here we are again. Kids are not, as you can see, the bulk of the cases. But clearly, over the course of the pandemic, the children here are in the dark blue, and we can see that, always having been, between 10 initially in the beginning, they were only 2.6% of the cases. As the pandemic has gone on, currently kids are about 25% of the pandemic. And so again, right now, since the children between 0 and 5 can't be vaccinated, they are the most vulnerable population. Because they don't have the choice of not being vaccinated. So again, we're really, seeing a lot of kids affected. I know Amy was on during the absolute peak, and we had lots of children in the hospital, and we are still seeing children within the hospital today. Again, just, each week, more and more people coming down with Omicron. So here we're looking at vaccinations of children between 5 and 11. And so we are getting, we've got kids who are have at least one dose. And as of last week, we're up above the 25%, but still not enough kids being vaccinated at this time. An interesting thing that we had read is that, and I didn't realize this was true actually until a couple of weeks ago when I did a webinar with a group of other educators, that there was a recent study that showed that parents were actually more likely to get their children vaccinated if somebody who was taking care of their child in an educational role recommended it. So for me, with the group that we have on the phone here, it just highlights how much all of us can help parents make those decisions for their kids, and how important you are as a group of people who care for these children, either in a daycare role, a pre-K role, an educator role, can also help families understand. And so we'll have lots of question and answers where we can talk about the facts surrounding the vaccines, so that you can take those facts back to families and help them get kids vaccinated. Here we're looking at the flu. Fortunately, again, there is not a lot of bandwidth for the flu this year. And again, with people still masking, we're keeping our numbers down. And again, as of very recently, really kind of in that minimal flu activity here in Ohio, which is good, because as we know, Ohio was one of the last states in the United States to go through the Delta surge. So we hit our Delta surge in October and then November, and we were still in the middle of our Delta surge when Omicron came on the scene. So as you can tell, our healthcare workers, our healthcare systems have been very stretched. And if we were to have a normal flu season on the top of all of this, it would not be looking as bright outside as it is today. So again, another thing we can encourage families to do, because we still have many months left of the flu season, is to make sure that all kids greater than 6 months have gotten their flu shot for the year. And again, you can see we're still really not seeing a lot. Again, talking about the vaccines, there have been so many things that people have been misinformed about, so many things that families are worried about, and just a lot of information out there. And so this figure here from the Kaiser Family Foundation really is, I think, some really great talking points for us to go over. You know, things that people have heard and reasons why they might not want to get the vaccine is because people feel that the government is exaggerating the number of COVID deaths. You know, in the adults, you know, we've heard numbers of 800,000. We know that about 1,000 of those or so have been children. You know, Amy and I can both tell you and let you know that if we were to have a flu season where 500 children died in the United States, that would be a horrible flu season. You know, each year we only have about 150 children, sometimes 200, 250 kids who die from the flu. We know that COVID is much worse for children. So again, and we know that these deaths have been caused by COVID. And so again, there really is no exaggeration that is going on. You know, another thing especially important for the families that you care for, many of the mothers are probably pregnant of the children in your programs. And we know for absolute certainty, the second one here says pregnant women should not get the COVID vaccine. That is absolutely incorrect. There is so much data now to show that pregnant women are extremely vulnerable. They have a higher incidence of severe COVID, needing ICU care, being on ventilators, as well as dying from COVID. In many cases, you know, dying at the time or near the time of delivery, sometimes even before delivery. And so, you know, we have had cases in Cuyahoga County of women who have died from COVID while pregnant. Some of them, in some instances, the babies have also been affected and have died. We know that the vaccine is incredibly safe in women. Women do well with all sorts of vaccines, and they do particularly well with the mRNA vaccines. So the Pfizer and the Moderna are absolutely recommended for these women because, again, in our area, we have seen families who have lost their mothers. And it's absolutely tragic, you know, for the fathers, for the other siblings, and sometimes for the newborn as well, if they make it. So really making sure that pregnant women are getting vaccines is really important. Again, deaths due to the COVID vaccine hidden by the government. This is not, there are no conspiracies when they come to this. There have been very, very few deaths attributed, mostly with the Johnson & Johnson vaccine in this country, with people who've had underlying clotting disorders. You know, with children, it is an absolutely rare event. And I don't even really know of any vaccines related deaths within children. I know that people look at the things on some of the government website. What they're looking at usually is the VAERS, where they will say that there, you know, are about between 6,000 and 10,000 deaths, depending on when they've looked at it. Those are all deaths for anyone who has received the vaccine. What that means is anytime somebody gets vaccinated that and dies within a certain period of time of the vaccine, that death needs to be reported. But I can tell you that those deaths are investigated. And again, really just a very small handful of those are actually attributed to the COVID vaccine. A lot of people are worried that the COVID vaccine causes infertility. Again, that is not true. We know that from the very first start of the vaccine trials, where women who were pregnant were not allowed to be in the vaccine trial during the first phase. And there were several women, and you had to promise that you would not get pregnant within 6 weeks of joining the initial trials. And there happened to be a lot of babies that were born by women who had said they were promising not to get pregnant as being a vaccine participant in the trials. All of those babies were followed now for almost 2 years. And they have all been remarkably healthy. So again, really no problem with fertility. There is actually, in the last 3 weeks, several studies that have come out to show that if you get COVID, especially as a male, that there is a chance for infertility. So I think a good way to think about the vaccines are anything that you may have heard about the vaccine actually happens in COVID. And when you get COVID, the side effects of those things that people are worried about are actually much, much worse and at much higher frequency. So again, when you get COVID, you're getting the whole virus. And so you will have, lots of different responses to that. And so, when you're getting the vaccine, you're getting a very small part of it. You're developing a very targeted immunity. And so if there are some of these side effects that people are seeing from the vaccine, we know that those side effects are actually seen during COVID and are much, much worse and much more frequent. We have people talking about other things, that ivermectin is a safe and effective treatment. We do not use that in this country as a treatment. We know it's very effective for parasites, and this is a virus. That you can get COVID from the vaccine. Actually, that's impossible because you're not even getting the whole virus. What you do get in terms of symptoms are something that's very positive. You're getting things like a fever. You might get some body aches. You may have a headache. What that means is that is actually your immune system reacting to the vaccine and developing immunity. So what you're actually feeling are the side effects of your immune system. It's not the actual virus itself. We, have had people talk about the fact that there's a microchip. Our technology in the world is not that developed that we can have microchips that are that small. Perhaps someday in, the next 200 years, but certainly not anything at this time. And again, people are worried about it changing your DNA. That is really not possible. What you get, especially if you get the mRNA vaccines, is just a very, very tiny piece of mRNA that codes for the spike protein on the virus. And it only lasts within your system less than 48 hours, and then it is completely disintegrated. And so again, really does not have any way to bring itself into your DNA and to be able to make any changes. And again, here we have this great news from the Kaiser Foundation, showing that a large share of parents who say that their children's school has encouraged vaccinating. And, again, it's really, really important that you, as people who are in the lives of these families, people that they trust, are helping to share this important information with families and the correct information. So we really appreciate all of you taking times. Again, we've got a lot of people who say that getting the vaccine is a bigger risk than getting coronavirus. And Amy and I can tell you for absolute certainty that is not the case. Any of the things that we see with the vaccine can also happen with COVID. They are much more frequent and much more severe. And again, really to vaccinate or not to vaccinate, really important things are, again, the overall risk, especially for children, is low at the individual level, but they can still transmit to those around them. And we know that not every single child is going to be a lucky child and not have severe COVID. Amy and I have seen many children in the ICU over these last 2 years. We've had children on life support, such as ventilators and ECMO, which is essentially bypass. And Amy will tell you a lot about the things that we're seeing that are happening to children after they've had COVID. And so again, we know that the immunity from the vaccine is very protective. We know that it is longer lasting than natural immunity. It's more protective than natural immunity. And it is protecting children not only from COVID, not only protecting their other family members, but also, as Amy will tell you, protecting them from the after effects of COVID. So I think we'll just continue to go on and have Amy share her next part. And then we will, I can see there's lots of stuff in the chat. Be happy to go through those questions for the group afterwards. Amy?
Yeah, hi, thanks, Claudia. That was fantastic. So what I want to dig into, there's a couple things that I want to talk about. I'm going to dig into some of like what we're seeing clinically with Omicron. And then I want to talk, as Dr. Hoyen mentioned, a little bit about the after effects of what happens to kids when they get Omicron or get COVID. And then I will wrap it up by kind of summarizing how the vaccine has affected this in kids over the age of 5. And I'll give you a little snippet of information about when we can expect the vaccine for younger kids. So next slide, please. So how are patients with Omicron presenting? The first thing that I want to say is a lot of patients with Omicron are presenting exactly the same as other variants. So I don't want this to be taken as we're not seeing any COVID pneumonia, we're not seeing any of the old COVID symptoms, loss of smell, taste, blah, blah, blah. But there are some new things that we're seeing with Omicron that we didn't see as much with prior variants. One of them is that we're seeing a lot more upper respiratory infection. So I have mentioned COVID pneumonia, where the virus gets down into the smallest part of the airway and causes infection. We're seeing a lot more croup. So that's an infection right here near the voice box. For adults, that would be more like laryngitis or sore throat. We're seeing a condition called bronchiolitis, which is where the virus infects the breathing tubes as opposed to the lungs themselves, the tubes that bring the air from the outside world down into the lungs. And that is somewhat unusual for COVID, but with Omicron, it seems to be very common. The nice thing about that is that many cases of croup and bronchiolitis can actually be managed outpatient. And so that is kind of an encouraging trend. Again, it's a slight trend. It's not a massive change, but we are seeing this kind of slight switch. And I do want to point out there's been a lot of confusion about whether Omicron is better or worse in kids or whatever. So if you look statistically, Omicron is slightly milder in children than the Delta variant was. That direct comparison has been made. However, Omicron is so many more times contagious than the Delta variant that more children are getting sick. So even though a smaller percentage of children are being hospitalized, a larger number of children are being hospitalized because a larger number of children are getting sick. So I want to make that very clear because I have heard people call it like Omicold, as if it's just the common cold, and dismissing it as if it's no big deal. Omicron absolutely still causes hospitalizations in children and in massive numbers because of how contagious it is. So I want to make sure that that's extremely clear. Next slide. So what else makes Omicron different from prior versions of COVID? One somewhat concerning thing that we're starting to see with Omicron is a condition called encephalitis. So encephalitis is a condition where the brain becomes inflamed. This is slightly different than meningitis. Meningitis is when the wrappings around the brain is wrapped in, well, something you can kind of think of as like saran wrap. And when those wrappings become inflamed, we call that meningitis. When the brain tissue itself becomes inflamed, we call that encephalitis. And we are starting to see encephalitis in children with the Omicron variant. And that's something we hadn't really seen with prior variants in any significant numbers. And we've had cases even here in Northeast Ohio of kids, teenagers and older kids with encephalitis. So that's something new. We don't yet know how common it is. We've only seen a handful of cases here in Northeast Ohio. I'm aware of handfuls of cases kind of scattered throughout the United States. It's probably rare in comparison with just the sheer number of kids who are getting Omicron, but because so many kids are getting it, we're seeing it a lot. And of course, anytime a child's brain becomes inflamed, we get worried about it. And of course, this is so new that we don't yet know what the long-term prognosis for this encephalitis might be. We do know, I mean, in nature, so if you look, for instance, at enterovirus encephalitis, you have almost 100% recovery rate. Whereas if you look at something like low cross encephalitis, you get like a 50% recovery rate. So we don't yet know where COVID is going to fall on that spectrum. Is it going to be more kind of mild with good recovery, and so not something to get too worried about? Or could we be looking at some kids going on to have neurodevelopmental problems? We just don't know, because it's something we've only seen in the last like four or 5 weeks. So we're still working on that.
Amy,
yes.
One just quick thing. Do you know if the children that we're seeing in Northeast Ohio, are they vaccinated or unvaccinated?
No, we have not seen any cases of encephalitis in any vaccinated
children. Correct. Yeah.
So again, we are talking about unvaccinated children getting Omicron.
Yeah, I just want
children.
Yeah, someone put that in the chat, but I thought it would be more effective if we just chatted about that right now. So yes, again, the severe things that we see when we have children end up in the hospital, when we have children end up in the ICU on life support, those children are mostly all unvaccinated. If they were vaccinated, it may be a child who has an underlying cancer or something where they probably didn't respond to the vaccine. But again, it's unvaccinated children where we're seeing all of these severe side effects.
Yeah, and I'll say in my clinical experience, I've had one vaccinated child in the hospital, and that child I knew was not going to respond to the vaccine, and that child actually still did fine. So all of the kids that I have seen in the hospital have been unvaccinated, me personally. Next slide, please. Okay, so one thing, so I want to shift a little bit from the acute illness with Omicron to what happens to children after they've had Omicron, or what happens to children after they have COVID. So there are two syndromes that happen in kids, and sometimes, well, one happens a lot in adults and one happens a little in adults after they get COVID. One is called MIS-C, that's multisystem inflammatory syndrome in children associated with COVID-19. And this is an extremely dangerous, life-threatening inflammatory response that kids get about 4 to 6 weeks after COVID. The other is long haul. Everybody's heard of that. It's been on the news. Adults get it very commonly. Probably about 30% of adults who get COVID go on to have some amount of post-COVID symptoms. We don't yet know what percent of kids who get COVID go on to have symptoms, but it is very clear that especially in kids over the age of 10, that long haul absolutely can happen. But what about Omicron? How does Omicron compare to Delta and other prior strains of SARS-CoV-2? So we are just now, so our peak for Omicron was like the last of December. And as Dr. Hoyen said, I was on service for that and it was awful. So that peak was at the end of December. So we're just now moving into the range for MIS-C, and we are seeing it. And there's a couple of things that we're seeing. One is we're seeing some of that encephalitis. So I had mentioned that kids who get SARS-CoV-2, acute COVID, can get encephalitis, but we're also seeing kids with MIS-C who have encephalitis as a component of their MIS-C, and that's also new. That's not something we've seen before. And I can tell you at least one case has it pretty bad. And then we're also seeing a shorter duration. So we're seeing some kids come in with symptoms of MIS-C when they only had COVID like 2 or 3 weeks ago, when with prior variants, it was more like 4 to 6 weeks interval between their acute COVID and when they come in with their inflammatory syndrome. Again, we're talking about unvaccinated children. So there was a study that came out 2 weeks ago that showed that 2 doses of the Pfizer vaccine reduced a child's risk for MIS-C by 92%. And so in theory, that does mean that some kids who are vaccinated can have MIS-C, but we haven't seen it yet. I imagine it will happen eventually, but the vast majority of kids who are vaccinated cannot go on to have MIS-C. So that's fantastic. The other thing that we're seeing, the other question is, what about long haul? Obviously, because our Omicron wave just hit, it's too soon to know if Omicron can cause long haul, because we define long haul symptoms as symptoms lasting more than 12 weeks past when the acute infection was. And so, of course, that interval, we haven't gotten 12 weeks from our Omicron surge yet. I will tell you, so I am, as was already mentioned, one of the co-directors of the Rainbow Pediatric COVID Recovery Clinic. And just based on the number of mostly teenagers, so it is mostly people who are 10 and older, that we're seeing with long haul symptoms from prior outbreaks, that if Omicron can cause long haul, we're in a lot of trouble, because so many kids have gotten it that it's just going to be a massive number of kids that will be struggling with long haul symptoms. And so that's something that's really concerning to me. The other thing that I want to point out, though, is that the vaccine has been proven to be effective in preventing long haul. So about 50% reduction in risk. So it's not a complete reduction in risk for long haul, but about a 50% reduction in risk. So yet another reason on top of all of the other reasons to encourage people to get vaccinated, because it just is better. I think that might be my last slide. You want to check? Yes. Okay. So that's it for me. I wanted to keep it short and sweet so that we would have plenty of time to answer questions. It looks like we have 20 minutes or 19 minutes.
Yeah.
So
that's great.
Fire away.
Yes. Okay. So
let's do it.
Yeah, thank you. I'm going to start with some more vaccine questions. So what I've noticed in the data is that the rates of adults getting vaccinated are so much higher than the 5 to 12-year-olds, especially 12 and up. It's better. 5 to 12-year-old, you said 25%. It's just so low. Are you hearing special concerns from parents? What? Because there are vaccinated parents who are worried about vaccinating their children. So is there something specific you can say about that? And then are there booster shots coming for 5 to 12? And then I'm going to start talking about under 5.
Amy, I'll let you take the first one.
Yeah, so I do a lot of clinical ID. In fact, I'm sitting in clinic right now, about to go start seeing patients in about 20 minutes. So I get this question. I interact with parents all the time, and it's a parent thing. So we're willing to take risks for ourselves that we will not take for our children. And even some adults who have taken the vaccine perceive the vaccine as risky. And this is, so I'm an infectious disease doctor, not a psychologist, but I have spent a long time in the world of vaccine hesitancy. And there are 2 ways that humans approach risk. So there's risk in prevention, and then there's risk in disease state. And when parents think about vaccinating their kids, believe it or not, they don't compare the risk of the vaccine to the risk of catching the disease. They compare the risk of the vaccine to the risk of nothing, of doing nothing. And in their mind, their kid isn't going to get sick. I know that's weird, but that's how parents perceive risk towards their children. Right. And so if the vaccine even has a slight risk, to them, that's too much, because their kid was at 0 risk before. Even though I, as a physician and as a logical human being, know that the risk is not 0 because we're in the middle of an Omicron surge, the risk is massive. Parents aren't comparing the risk of the vaccine to the risk of the virus. And so that's why the vaccine is perceived as so risky for the children. And so what I have been doing as a clinician educator. And what we as a community have to continue to do is to remind the parents that the risk of not vaccinating is not zero. The risk of not vaccinating is the risk of what Omicron can do to their child. So what I talked about, croup, bronchiolitis, encephalitis, myocarditis, all the things that we know that COVID can do to children, that's the risk that a parent takes when they don't vaccinate. And so it's all about changing how the parent perceives the risk for their children is how we get them vaccinated. And in fact, if you talk to parents who do get their children vaccinated, that's exactly what they say. They say that they understand that that the risk to their child is the risk of the virus as opposed to nothing. And so that it's all about reframing that parental risk evaluation. The other thing is they genuinely believe that vaccines have to be studied for 5 or 10 or 15 years before knowing whether it's safe for children. And they actually believe that vaccines like the hepatitis B vaccine or the MMR vaccine that they're happy to give to their child has been studied that long. They don't realize that vaccines don't need to be studied that long because they're only in your body for a couple of days. And so for us, we only study vaccines for like a couple months and then we stop.
Yeah.
And so that's all just about education and helping parents understand what is actually true. If that all makes sense.
Just questions, crystal ball, when is there going to be the booster available for 5 to 12-year-olds? And then I do want to really focus after this on under 5s, both.
Sure. Yep.
You know, so I'll let you ask the booster shot for 5 to 12s.
Go ahead, Amy, on the booster, and then I can do the younger kids.
So the booster, so there's no data on kids and booster shots. And in fact, I will be very clear, there's no data on teenagers and booster shots. The approval of the booster shot for teenagers was based on adult data. And so it is actually not clear if need booster shots. And part of this, again, comes back to reframing COVID. So up until Omicron emerged, so Delta variant and backwards, our main focus was on preventing COVID infections. Omicron is so contagious that is no longer a realistic framing of how we approach COVID. We are all at some point in the next year or two going to get COVID. That is something we are all going to have to come to terms with. The framework that we now need to create around COVID is how do we get COVID? We want to get it in the safest way possible. So we want to be vaccinated. If we're in those high risk groups, we want to be boosted. We want to wear our masks so that the viral load that we get exposed to is as low as possible to minimize our disease and symptoms. And so the question is, in light of the fact that everybody is going to get COVID, do children need boosters? They were already in a mild group to begin with. The vaccine virtually eliminates the risk for MIS-C and cuts in half the risk for long haul COVID. And then you have to balance that with the minimal risk of side effects from the vaccine. And in particular, if you think about like early adolescent boys and that slight increased risk for myocarditis that we see with the vaccine itself, and then you balance that with, what happens when a fully vaccinated, meaning 2 doses of the Pfizer vaccine, gets Omicron, it's not actually clear if the risk benefit ratio tips towards kids requiring a booster. That's science that we still need to explore. And I'm probably getting a little technical there. But what I will say is part of the discussion that we need to start to have over the next 6 months is moving towards reframing our understanding of getting COVID. Since Omicron is so contagious, we're all going to get it. And so this idea of keeping COVID out or having 0 cases of COVID just isn't realistic anymore. And so boostering ourselves to 0 COVID is not ever.
Okay.
And then as we're looking at the younger children, Rebecca, I know that was the second part of the question. The results that the Pfizer team got for the kids that are between 2 and 5 were a little disappointing. As we know, the children between 5 and 11 got a much, much smaller dose than anyone over 12. And this is why it is so critical that these studies be done on different age groups, because, of course, we know children are not little adults, but children, even at different ages, are not the same as children of another age. So that the, 6 months to 2-year-olds are very different than the 2-year-olds to 5-year-olds, who are different than the 5-year-olds to 11-year-olds, and so on. So when the studies for the children that were between 2 and 5 were done, again, the company used, the best information that they had, which was to use the same dose as the 5 to 11-year-olds, which was a very good place to start. They did see that there was less efficacy in that specific age group. And so we had assumed that data would come out at the beginning of December, which it did, but it showed that they didn't have the efficacy that they wanted. And so they continued to study that age group, the 2 to 5-year-olds. And what they did is, for that group, they gave them a third shot. They didn't call it a booster, they called it a third shot in the series of the vaccination. And so we are now waiting to see those results. We're hoping that those results will be out within the month. And then we know that there's a couple of week lag once those results come out. If they show that it's working, it's efficacious and safe, we know it's safe, then they'll have to go ahead and go through all the FDA, CDC regulatory issues. So I would think for children between 2 and 5, the earliest we're going to see is probably March, if not into early spring.
Okay. So what's a parent to do? As you said, those under 5s are the most vulnerable in the sense that they can't even get vaccinated. So what do you advise parents? Do you put your child into preschool? Do you put your child in childcare because you need to work? How do we manage? What can you do to manage the risks, knowing that they are still vulnerable?
Well, I think that's where we have to think of this. Again, a pandemic is not about us as an individual. When we're in a pandemic, it's about us as a community. And so what we need to do to protect those most vulnerable children is for all of us around them to be vaccinated. We need as little COVID circulating, because again, their risk is going to go down if there isn't COVID circulating. We need to be sure that, if we're taking kids out and if we're out as adults, that we are wearing masks in public, that, if we're in a situation where people aren't masked, the CDC has now recommended that you should think about a higher level grade mask, a medical mask, or perhaps a KN95 or an N95. Again, I can only say what happens in the hospital, but really in kids over 2, we do not have a lot of problem with those kids masking, and even some kids younger. I don't know if it's the same that you're seeing in your preschool settings or not, but the kids want to do what they can do to keep themselves safe and to keep mom and dad safe and their brothers and grandpas and aunts safe. And so again, it's really those basic things that we learned early on in the pandemic. Those are things that we need to be doing now, and we need to be doing them for the children. So getting people vaccinated, getting as many kids around them vaccinated, getting their siblings vaccinated, again, will just decrease their risk.
So I will answer that question in a slightly different way. I am a pediatrician, but I'm a mother of a 3-year-old and a 5-year-old. So I have one vaccinated child and one unvaccinated child in my household. And the strategies that Dr. Hoyen was talking about, that's in the vaccine world, we call that cocooning. When you have a vulnerable member, you cocoon them basically around people who can help protect them. And so I, as a parent, have had conversations with my child's school or daycare, and with the people that are around him. And I don't allow unvaccinated people around my child. I've had very open and frank conversations with his teachers. They are vaccinated. I have had open and frank conversations with the parents of his friends. And nobody comes in our house who is unvaccinated. And that may seem a little strict, but that is how I run my household. So my son is only around either other unvaccinated children because of his age, but friends that we allow him to play with are only friends whose older siblings and parents are vaccinated. And that's just how we do it. And I will say, 2 years in, no COVID in my household so far, so it must be working.
So I know that with Delta, we felt pretty secure that we weren't contagious if we were vaccinated. But then what I've heard, and some of the pushback, frankly, I've heard is, what's the difference now? Because if you're vaccinated with Omicron, you can still be contagious. So can you?
Yeah, so what you're going to see is you will be contagious. Absolutely. And you're typically contagious before you know you're sick. So good reason why when you're in public, you're doing things like wearing masks. The thing that the vaccine is going to help you do is your immune system is going to be several steps ahead than someone who's unvaccinated. So that as you come in contact with the virus and it starts replicating in your nose, your upper respiratory tract, your immune system is going to be ready to turn on. And so you may get, a high viral load enough to make it yourself contagious to others, but it's going to be very much shorter than if you were unvaccinated. So again, getting vaccinated, getting boosted is going to shorten that time, decrease the viral load. And so it's just really important that all of us are keeping up, no matter what our risk is, because we don't know who's going to come into our life that is at more risk than we are.
Right. And there's two things I want to add to that. One is not everybody who is, despite what I just said about we're all getting COVID, actually we're not. I was being a little dramatic when I said that. If you are vaccinated and boosted, you can actually not get Omicron, even though it is very contagious. So one of the things that the vaccine will do is you may just be one of those people who doesn't get COVID despite being exposed. So you can't share the virus if you don't get it. And while it is true that some people who are vaccinated do get high viral loads, there's actually a study that just came out, I think it was like 3 days ago, that showed that those people who are vaccinated aren't transmitting the virus as efficiently as people who are unvaccinated. And so even though I can take a swab and detect tons of virus coming out of my nose, I seem to have a harder time giving it to other people. So I'm not as contagious as somebody who's been vaccinated. So I want to be very clear that it's not true that vaccinated individuals can spread Omicron as easily as unvaccinated individuals. And so there is a measure of protection there, that it may sound a little subtle, but it will make all the difference in the world when it comes to keeping the people around you safe.
Yeah.
Okay. So I hate to ask this question. Well, first, let me say to everybody, because I know there are a lot of questions we haven't gotten to, but we are going to have this recording up on our YouTube channel with the PowerPoints. We'll make that available. I'm going to put you both on the spot. So there are some other questions we haven't gotten to. Would you be willing to maybe do a little Q&A in writing that we could send to you, that we could send out as well?
Yeah,
absolutely.
Okay.
Yeah, we can work on that together.
Okay, that would be great. So my last somewhat, I sort of hate to ask it, but I'm going to ask anyway. Is there any other variant on the horizon that we should be on the lookout for? Not that I want to do another webinar, don't get me wrong, but I'm afraid, I think some of us now feel we're afraid to let down our guard because of Omicron just like came out of nowhere. So we all want to get back to normal. What can you tell us about endemic, and also what endemic means versus pandemic?
I mean, I think, for right now, there's been some talk about Deltacron, but that, we would worry that it would be more severe than Omicron and more contagious than Delta. But that does not seem to have taken off as much as people were thinking about 3 or 4 weeks ago when that kind of came onto the scene. Of course, there are always variants that are being detected. And again, even though it's very easy for these variants to form, as we've seen, we're only halfway through the Greek alphabet at this point, 3 years in. And so again, we are forever watching, and unfortunately, as we've learned, nobody's crystal ball is working. Amy's is broken, mine is broken. This pandemic has humbled us into realizing that we just all need to be on our toes. We need to be doing the things that we know will keep us safe, and we just need to stay as up to date, and continue having us engage in webinars with you as possible. Amy, anything else on the scene that you're hearing about?
So the only thing I will say is there will be other named variants. Like, I don't want people to panic prospectively. They will come, because these viruses only have the ability to proofread their DNA a little bit. So they mutate all the time. Now, most of those mutations are clinically silent or actually make the virus weaker, so that particular variant dies out. The only variants that we care about are variants that change the virus in a significantly clinical way. That will happen again. The question is in what way, and we don't know yet. The dread, as Dr. Hoyen mentioned, is it's a worse virus like Delta. Remember, Delta made patients clinically sicker. Omicron is a slightly milder, but Delta wasn't as contagious as Omicron is. That marriage of a more severe virus that's also more contagious is kind of our nightmare scenario. But it could also be that new variants become more and more clinically mild. We know that there are 4 human coronaviruses that existed prior to this pandemic. There are dozens of non-human coronaviruses. It is possible that we got those human coronaviruses from prior pandemics, pre-recorded history type pandemics, that and coronaviruses in humans, maybe they tend to mutate towards being more mild. We don't know. So I don't want people to freak out when the next letter in the alphabet gets made, because it may not end up being clinically relevant to us here in the United States, or it might. We'll just have to wait and see.
Yeah, as we've seen, there have only been 4 or 5 that have been clinically relevant throughout the whole pandemic. And just to let you know, Amy and I will be canceling the pandemic when we get to the end of the Greek alphabet, because we are not going to another ancient alphabet. That really, so count your letters,
okay.
People.
We will keep that in mind. Well, I see that we're at 1 o'clock, and I know Dr. Edwards, I think you have to scuttle off to clinic, right? And I know Dr. Hoyen, you're also very busy. A lot of interest, a lot of thank yous from people for doing this. And we will sift through these questions to see which ones we didn't get to answer. Then we would enlist your help in responding. One very quick question. People are asking about the quarantining time periods and childcare. Should they look to the public health authorities for that?
Yes, that is really where we are as well. We actually have a daycare at UH at our Parma facility. And we also follow what comes from the state and from the CDC. So again, whatever the latest information that you're getting from either federal or state or county regulatory bodies, that is really what you need to be following, because that's what we're doing as well.
Okay, great. Well, again, lots of thank yous coming in. I hope you're seeing some of them.
And what we'd really like to see is the cocooning posters. So,
whoever I saw that chat. Whoever makes those posters, shoot me an email.
We want to see them. Because we recommend this all the time when people are taking their newborns home. We ask them, during flu season, to be sure everyone gets their vaccine. Again, cocooning is something that we do, and let's spread it. Okay, well, the gauntlet has been thrown down. We have a challenge as the early childhood community.
Yes.
So we'll have a cocooning poster contest.
A cocooning poster contest. It sounds good to me. Okay, well, again, so many thanks to all of you, to both of you, for sharing the information, and to everyone who's come to hear the information. And again, you'll hear back from us about the recording and and the slides and some more Q&A. So again, thank you so much, everybody. Stay warm,
Yep, stay safe.
get
And thank you for
vaccinated,
what you do. Yeah, vaccinate,
Yeah.
get those families vaccinated.
get everybody vaccinated. Okay,
Thanks.
thanks again, everybody. Bye-bye.